millions have been invested. We're not really seeing a return on that investment within the market. Investors aren't, and then we're not seeing the positive benefits for population health or even individual health. Well, hello, welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar with Rehab U Practice Solutions. And if you want to develop an effective, succinct, and unique positioning strategy for your healthcare organization, whether you be a device, a technology company, or even a provider organization, check out the Healthcare Positioning Alignment Workshop, where we help you answer the question, value to whom? Basically, in order to develop an effective value proposition, one that's actually going to drive leads and sales for your business, you need to understand the stakeholder that you're going to target with your message, whatever your offer is. Depending on where you're at, who you're talking to or targeting within healthcare, they determine, because of their position in the value chain, what they consider valuable, the outcomes they're seeking from any solutions or services that they're procuring or vendors that they're going to work with. And it all depends on their view of the healthcare system, right? For example, payers want to reduce costs, providers want to get paid more, and patients want to get in and out, they want to get better, and they want to do it in the least amount of time possible. So by narrowing down that value to whom question, you have a clear idea of how your technology, your device, your software, or even the healthcare service you're going to provide solves the specific problem faced by that targeted stakeholder. Again, it all starts with positioning. I've talked about this a lot on the podcast, on other interviews that I was on, that positioning in healthcare is critical specifically because we've got 4 different stakeholders at play, and it really depends on who you're talking to. The same service, the same software, the same solution really needs to be discussed in different ways depending on who you're talking to. So we can help you do that with the Healthcare Positioning Alignment Workshop. If you want to learn more about that, go to positioning.rehabupracticesolutions.com. That's positioning.rehabupracticesolutions.com. Alrighty, this week we're doing another solo episode, a deep dive into a couple LinkedIn posts that I threw together. I'll link to them in the show notes. They kind of just took off, and I wasn't really expecting them to do that, but I figured, well, if there's this much interest, we'll do a podcast episode on it. So the first one was a post about really healthcare technology and startups. And the way I titled it was, this is going to be an unpopular opinion, but too many healthcare founders and startups believe that their solution, their device, or their software is going to revolutionize health and well-being or revolutionize the healthcare space. And my opinion or my view on that was that digital health is not going to be as effective as everyone says it will be, at least not yet. And there's some caveats. And the main reason for that is our misunderstanding as an industry around how to effectively implement these technologies. So it's no secret, millions have been invested in healthcare tech. There was a pullback at the end of 2023, and 2024 has been kind of slow, but there have been a lot of VCs, a lot of investors, angel investors, investing in healthcare technology startups. Why? I think the disconnect between the millions that have been invested and the lack of true value creation, whether in the form of return on investment for the investors or clinical outcomes in population health, the main disconnect has to do really between the perceived benefits of those services or the solutions or the vendors or whatever they have, and the value that these solutions and the actual behavior change that is required to implement them. So that was the first post. I kind of dove into that a little bit. So millions have been invested. We're not really seeing a return on that investment within the market. Investors aren't, and then we're not seeing the positive benefits for population health or even individual health. Maybe on like case studies, but as a broad general rule, for the amount of money that's been invested in digital health, we haven't seen corresponding outcomes. If you disagree with that, shoot me an email, info@rehabupracticesolutions.com, and we can have a discussion. But this is just the way I see it. And I think part of that has to do with, again, the fact that there's a disconnect between the perceived benefits and what's actually required to implement it. And now this has 2 parts, 2 big pieces. One is the behavioral change required within the organizations that are going to be implementing these services. And then the other one is the context with which those services or in which those services are currently having to be implemented and existing. So this bounces back to that second post, which was all about the healthcare system we have specifically here in the United States. So I start by saying we don't have a healthcare system really in the United States. We have a highly sophisticated and elaborate disease management system. And what I mean by that is a healthcare system, at least in my opinion, and probably in some of the literature would recommend this or propose that this should be what the healthcare system focuses on, would be facilitating and enabling healthy lifestyles. But we do very much live in a system, at least here in the US, where you don't get healthcare services unless you're sick, unless there's an injury, unless there's something we need to quote unquote fix. Now, there's been some movement over the last several years into preventative modalities, health and wellness, lifestyle management, healthy lifestyle management, and that kind of stuff, or healthy lifestyle promotion. But there's still a very heavy focus on treatment and disease it's more of a reactionary approach to healthcare rather than a proactive approach. So, and there's a couple reasons for that. The main reason is the way we pay for healthcare services. And this bounces back to why digital health is struggling, at least in my opinion, to make any real impact. So the way that healthcare providers are paid currently is for CPT codes for treatment procedures and modalities, and really their time. So we can talk about the fee-for-service model and whether or not that's part of it. If you've read the book Better Outcomes: A Guide to Humanizing Healthcare, you know that I'm not a fan of the fee-for-service model, but really it's the underlying philosophy of the payer. So let me break it down here, and then we'll kind of dive in. So digital health isn't seeming to make the impact we want it to make. Why is that? We don't understand what it's going to take to implement it successfully. And there's two reasons for that. One, the behavioral change component, which we'll talk about separately. And then two, the context within which these solutions are being expected to perform versus their ideal environment or context. So going back to probably the bigger one, and then we'll talk about the behavioral change at the end. The bigger one is kind of the context, because if you have the right product or a good product in the wrong context, it's still going to do very poorly, right? If it's not able to solve the problem within the constraints of its environment, it's not going to do it. It's just not going to do well. So let's start with that. Healthcare, especially here in the United States, is very procedure focused. It's very disease management focused. And the question is why? Why is healthcare in the United States, or the healthcare in general, probably Western healthcare, so focused on managing disease, on treatment codes and procedures versus proactive lifestyle enhancement or promoting healthy lifestyles and healthy behaviors to prevent hopefully injuries and illness down the line. I think a big piece here, and this is going to be, some of this discussion is going to be fairly specific to the United States, but it also I think applies in single payer systems as well. So primarily, there's been, in the United States, the major payer is very, very rarely the patient. Very rarely is it that the patient or the client, depending on where you're at in the healthcare industry and how you want to talk about them. I prefer the word patient because I feel like it's more humanizing, but the patient comes in, receives services at a clinic. That patient is paying a small percentage of the total fee for delivering or for receiving those services. Sometimes it's a flat copayment, sometimes it's a percentage, 10, 15, 20%. But the bulk, on average, the bulk of the payments are being made by a third party, and that third party is an insurance company. For the most part, we've done shows here on the podcast about health shares. I'll link to that in the show notes if you really want to explore more about that. It's the way I believe healthcare should be running if you need somebody to help pay for healthcare. But that's kind of the fundamental baseline here in the United States. In other places, we've got single payer system or even a mixed system. you might have some commercial payers, but then the big payer of healthcare services, the majority of it, is the government, right? That single payer solution. And even that, you have a disconnect between the end user or the recipient of the services and the person paying. And anytime you have a misalignment or a malalignment or a difference in those two things, in the payer and the recipient, there's just going to be competing interests, right? Even in a single payer system where you've got the government paying for all the healthcare systems, global, Medicare for all or global healthcare, whatever you want to call it, that payer, the government in this case, is still going to be incentivized to reduce the amount of spend. So we'll just move on from that because I think that makes sense, and it doesn't really. There's going to be a little bit more relevance to the point I'm about to make in the insurance realm of things, but it'll still count here. So, kind of laid that out. So, insurance here in the United States is the major payer, and what does that mean? It basically means that the entity or the group that is paying or bearing the majority of the healthcare costs in the United States is an insurance company. So what has happened, and you can go back into the history and you can argue about whether or not this should or shouldn't have happened. I'm not here to make that argument one way or the other. But what I am going to say is that we have conflated here in the United States, and probably in Western medicine in general, with the idea that health care and health insurance are the same thing, and they're not. Healthcare, like I said, should really be one of those, should be focused on promoting healthy lifestyles, prevention, disease management, and treatment can be part of that, but it shouldn't be the main focus. Health insurance, on the other side, is really a different beast altogether. Health insurance is something, or really insurance, in every other sense, insurance acts or should act as a financial safety net. It basically helps you prevent loss in the event of some kind of catastrophic incident. In this case, a death, an injury, maybe disability or something like that. The same way you insure your car because you don't want to or you can't afford to buy a new car in cash or whatever. If the car gets totaled, the insurance prevents that catastrophic financial loss for you. That's how insurance is, and that is the context within which insurance operates. This is relevant for healthcare. Let me get there. As one of the podcast guests said, I think it was Dr. Lamberts when we were talking about direct primary care, he said, we don't use our auto insurance to pay for routine maintenance like oil changes, but that's how we expect and treat health insurance here in the United States. We expect it to cover that routine and preventative work. And part of that is because we've conflated this idea of health insurance and health care. They are two different things. They're two very separate things. Like I said, insurance in every other sense, in every other industry throughout the world, it should be viewed as and it operates within the context of being a financial safety net or a safety net in the event of catastrophic incidents occurring. That being said, that kind of makes it understandable why the healthcare system, at least here in the United States, is really, really focused on treatment, on codes, on limiting cost. It's because health insurance focuses so much on quote-unquote treatment for disease. It's really just the lens by which it sees the problem. Health insurance began as a way to protect against the financial loss involved with the disease or catastrophic injury. So you can make the argument that, if health insurers focus on long-term spend and the like, it would be a wise investment to cover health, healthy lifestyle promotion and wellness and all of that. And some insurance companies do that, like my dad's, I think he's with Blue Cross maybe, or an Anthem plan or something with his employer. And they were like at one point in time giving people credits to go buy Fitbits and Garmin watches and stuff like that so that they would quote unquote promote a healthy lifestyle. You get some kind of credit, or they would pay for a wellness membership at a gym or the Y or something like that. So some insurance companies are doing that, but really the entire insurance industry is really looking at and focused on mitigating loss, which means they're trying to to put a cap, and they're trying to limit the amount of spend on healthcare services, which means they're focusing on what's important, the diseases right now. We need to manage those diseases. We need to do it in the most efficient way as possible so that we can decrease the overall spend on healthcare services. So that's just the lens through which insurance is approaching the healthcare problem. So you might argue that it's something they should be considering, this whole move to health lifestyle management and wellness promotion. But since they are in existence to protect against loss, it's just a hard sell. It's like trying to change an entire industry, right? So what that means is you've got the context of healthcare, or the environment of today's healthcare, economy or industry or whatever, being really focused on managing disease and managing injury. And the reason for that, just laid out, was because of the main payer of healthcare being an insurance company as opposed to the patient themselves. So what that has done is that has created an environment that is very focused on efficiency, on treatment codes, on billing, on all of the mechanism, the apparatus that is revenue cycle management for many health providers involves compliance with coding, making sure that the diagnosis codes, the disease codes are in there correctly, all of that kind of stuff. So that is almost a sub-industry within healthcare. Very difficult to upend and uproot that. So how does this connect to digital health and the problem that we're having with implementing digital health technologies, or having or witnessing or experiencing the benefit that they purport to create? Part of the problem is that in an ideal world, a lot of these digital health technologies operate in a way that is counter or doesn't fit within the mold of this disease management. Some of them do, remote patient monitoring, maybe remote services that allow for screenings and stuff like that for hospital admissions and things like that are great. But the reality is the big piece that has really, from a revenue side, prevented healthcare technology companies from really becoming widespread is the reimbursement piece. How does it fit within this context that we have of healthcare, where we're managing diseases, we're trying to do it more efficiently, but we're getting paid for the time that we spend with patients, and we're getting paid for the codes that we bill? Like, obviously you can see the difficulty there. If the digital health technology or solution limits the amount or decreases the amount of visits, for example, or codes that can be billed in some cases, it's a net negative for the provider. They're going to be losing money. Now, you could, again, make the argument that it might increase access, and I would make this argument that it's increasing access. You're going to be billing each patient less, but you'll be billing the same, if not more, across. That's great. And I think that's the discussion we need to have within the digital health space, is not so much what is the ideal. Ideally, this would be something that would just be paid for on a subscription basis, on a per member basis, or whatever. We wouldn't have to deal with coding or any of the fee for service piece of healthcare. It would just be like this global benefit, and it would improve. I mean, that's the ideal, right? The problem is that that's not the context in which the buyers of this software or solution work. They work in an environment where they need to bill so many units to get paid, and paid enough to keep the lights on and pay their people and, plan for growth and expansion. So there's a big disconnect there in how providers are being paid, how technology might improve their efficiency, but at the same time cause a net loss in some cases to the revenue. And then the here and now. So one of the ways that I see overcoming this issue, and I've talked about this with some of my clients in the healthcare technology space as they're getting ready to go to market, or as they are, entering the market and serving providers, is that obviously the goal should be something like a value-based care arrangement, or the goal should be something like where we're leaving this fee-for-service model that incentivizes high volume, marginal or mediocre quality. And that should not be something that we shy away from. at any stakeholder in healthcare, whether you're a provider of healthcare services, whether you're a payer, whether you're a technology or a vendor or something like that, a solution. That always needs to be in the forefront. We need to be talking about that. However, the solution that is being sold today needs to do two things. One, it needs to be able to work in that future of healthcare, that value-based healthcare of the future that we've been talking about since I was in grad school 14 years ago. So it needs to do that. It needs to put provider organizations in a position to succeed and to be able to do that effectively in the healthcare of tomorrow. That's part one. Part two is that it needs to be able to be reimbursed now. There needs to be codes that it can be attached to, ways that it can be utilized or implemented within treatment that work on those efficiency gains and those revenue gains. And sometimes it takes a little bit of brainstorming, it takes a little bit of strategic work. Sometimes it might even take some additional dev time to make that piece work, right? But it is well worth the investment because, again, one of the two main issues with the barriers to increasing adoption of some of these technologies and solutions, the big one is the money piece. How do providers get a return on investment for their money now? Not in the future when value-based care, this magical value-based care fairy comes and transforms the healthcare environment, but now when they're billing for patients, when they're seeing patients every day in the clinic and they're already cutting razor-thin margins, how do they do it? How do they implement this technology in a way that helps them survive and thrive within this context, but then put themselves on stable footing for moving into the healthcare of tomorrow? So that's the healthcare, the money piece. The other piece, the other side, so leaving the insurance revenue RCM side and moving on to the behavioral change piece, what I opened up the show with, saying that there is a disconnect in what digital health companies are saying are the valuable aspects of their software or their solution and the understanding around the behavioral changes really required to implement those. So what do I mean by that? I'm a big fan of saying, and I've said this a lot of times in several interviews, maybe on the podcast a few times, like people don't like change in general. Clinicians are even more averse to change because of the environment in which they're working. They're working on this high volume environment in healthcare where they're having to see so many patients, where they're having to complete documentation that's compliant and then bill so many units. So they're very averse to change in any aspect of that care delivery because it means there's going to be, in their minds, more work for them, another step. It's going to slow them down. What does it do to their documentation and their billing? All of these things are happening. So healthcare technology companies generally have maybe some kind of understanding about this, but not a real in-depth understanding about it. They understand that, yes, behavioral change needs to happen for them to use our software, but they don't understand the greater context within why those clinicians are so averse to that change. Again, I used to say this when I was a manager at a clinic. I'll say it now to my team downstairs in the clinic that I own and operate now. But clinicians, for example, if you wanted to move the clock from this wall over here to the one on the opposite side of the gym, the treatment gym here in the PT clinic, I would probably get a couple clinicians would say, oh yeah, no big deal, and then there would be a handful that would be very, very adamant about it's been here for so many years, we can't change it. And part of that has to do with because it's part of their workflow, right? So whether it be on the provider side or the patient side even, implementing some of these technologies requires real behavior change. And we'll focus on the providers, then we'll move on to the patients, but I'll label them to both of them here. So providers, and this is kind of the big hurdle, need to change their workflows and processes in order to integrate some kind of new technology or software. That's kind of the big one. The second one is that patients themselves need to initiate new behaviors to adhere to the use or the implementation of those solutions. Maybe it's a wearable, maybe it's a portal that they need to check, maybe it's something they need to sign on to. And history would show that we've been very bad about seeing positive results in that in healthcare. it has not been very effective in the healthcare system to facilitate really changes, positive changes, or any changes in patients' behavior. And there's challenges there too. And I've written an article about it. I want to say it was a chapter, or at least I reference it in the book a little bit, Better Outcomes, like How to Humanizing Healthcare, about how clinicians really are in the behavioral change business. But it's much the same with healthcare technology companies. And what the conclusion that I have here is that digital health tools, if you get the RCM piece, the revenue piece fixed, that will do a big step. That'll take a big step towards getting more adoption and then return on investment for the investors themselves, and then value creation in the form of clinical outcomes. But until these healthcare technologies understand and are implemented within the context of effective behavioral change for all the involved stakeholders, they're never going to get the uptake. So the big takeaway, at least as I see it here, is trying to figure out what exactly, and this is where, maybe a focus group, maybe having an advisor on that tech teams or the digital health teams roster that is a clinician that has been within this use case and can speak very competently and in depth about the normal procedures, the normal workflows, things to be to consider, maybe little known things that might not be a big deal to a salesperson or even an administrator in a healthcare organization, but is a really big deal to the boots on the ground clinicians. Having somebody in the corner can really help you facilitate some of that and kind of build that into the product, which is very, very positive. And I've done that for a few healthcare technology companies, where my whole engagement with them was really just advising them on how their software or their technology worked within the context of like a physical therapy environment. And it was very, very valuable for them. A couple of these companies went from very, very difficult sales conversations to very easy sales conversations, but then it's not just the sales conversation you have to worry about. It's you get it in the clinic, but then it's not being used. So that's really where having an advisor can be beneficial, and not just an advisor that does this for everything, but like an advisor that hopefully has clinical experience or has very close ties to the clinical world within that use case. So anyways, that's a big piece. So providers need to change their workflows in order to implement some of these technologies. So sometimes it is as simple as training and taking the time to understand how it's being used, so that you can make changes either on the dev side, like maybe it's something as simple as a plugin or an integration. Maybe it's something that you understand there's a barrier and you're going to build for it in the future, but you can build a workaround that does not add a whole lot of extra time. But those, in my mind, are the two big barriers for some of these digital health technologies to make it into the market. One is the context within which the economic context within which they're operating currently, or they're being introduced, versus where they're gonna be, like this idea of value-based care versus fee-for-service. And then also the context of this is how it's being used within this workflow, and there are barriers to utilization, because sometimes selling it to a hospital administrator or a clinic administrator is not a difficult task, but getting the clinicians to use it day to day is. So those are the two big challenges within the digital health industry. I've already kind of laid out some of my ways to fix it, so I'm just going to review it very quickly, tap them out, and then we'll move on. So number one, the big barrier being the money side. So where the software, the solution is being introduced versus where it's going to thrive, that whole idea of fee for service versus value-based care down the future. I think the biggest way to overcome this barrier really has to do with creating a product that can be where the providers can achieve a reasonable return on investment immediately, but then also position them for success in the future. So if it's something that is like asynchronous telehealth or something like that, it's asynchronous services, which is not currently reimbursed for in like the physical therapy market. If there's a way that you can add a feature, create some kind of education or innovative way to implement that treatment within the context of the current fee-for-service model, the provider can then use your solution, get paid for it now, but then also know that in the future, in the healthcare of tomorrow, they're going to be positioned to not only survive, but thrive. So that's number one, overcoming the money piece. Number two is going to be overcoming the utilization piece, or clinicians not opting in or not using it in the clinic with their patients. The main way to overcome this is really to take a deep dive and understand that specific use case for those users, those clinicians, and then understand the workflows and how that software or that device or that solution fits within it, and then do one of two things. Either create workarounds that don't take a whole lot of extra time, or a process of implementing it that doesn't require additional burden on the clinicians, or look at what you can do on the development side to make it more of a seamless integration. And it's probably going to take a little bit of both, honestly, just because of how a lot of clinicians have their tech stacks are all over the place, right? They've got, software vendor for this, a software vendor for that, and you're probably not going to be able to communicate or integrate all of them, but you can at least find a way for that to work within their workflows. So those are the two big barriers. Those are my big two takeaways or possible solutions. I'd love to hear your thoughts. Shoot me a message if you think this is yes or no, you're an idiot and don't ever talk about this again. Shoot me an email, info@rehabupracticesolutions.com, or hit me up on LinkedIn. I'd love to hear your thoughts, where you think this, I've got a good take on this, or whether you got something to add to the conversation. And if you are a digital health company that's figuring this out or trying to figure this out, and you've got an interesting take on it and want to discuss it on the show, shoot me an email. I'd love to have you on the show, and we can kind of talk about it on both sides, from the provider side and the solution provider side. And I think that'll be it for this episode. If you like the show, you can head on over to iTunes. You can leave us a rating and review. You can also share the show with somebody that you think would find it valuable, whether that be somebody that's a provider, a healthcare provider, or somebody that's in the healthcare space, an administrator, a healthcare technology founder, or something like that. We're trying to humanize the healthcare experience. I firmly believe that digital health and virtual service delivery is going to be a major component of that. The ability to leverage technology, and I've said it before, the ability to leverage technology in order to hyper individualize the care for individuals of individual patients without adding increased burden to clinicians, I think is going to go a huge way in making healthcare more human, a more human experience. So I definitely want to see it succeed. It's just a matter of, like I said, figuring out a couple of these. They are big problems, big challenges, but they're not anything we can't overcome given the right dialogue and the right solution in place. So anyways, that's my take on that. If you want to check out the book, Better Outcomes, A Guide to Humanizing Healthcare, you can do that at book.betteroutcomes.show, where I walk through the 8 commitments that healthcare organizations and vendors and all that can make in order to return the focus of healthcare to where it should be, which is a human. All right. That's it for me. Until the next time, folks, be safe, be healthy. I will talk to you then.